Welcome back, everyone. We're diving into the world of RNA therapeutics today.
RNA
A
therapeutics.
field that's really,
Yeah.
I think, changing how we even think about medicine
Absolutely.
and how we approach treatment. So kind of exciting stuff.
Yeah, it is.
We've got excerpts from an article called The Power and Promise of RNA Therapeutics.
Okay.
And we're going to unpack that.
Sounds good.
Yeah.
It's, I think a lot of people have heard about gene therapy and things like that, but RNA therapeutics is really kind of the next level. It's
Yeah.
not science fiction anymore.
Yeah, right.
We're talking about real treatments that are available right now that can silence specific genes.
Okay, so silencing genes.
Yeah.
That sounds a little intense.
It is powerful, but it's also very precise.
Okay.
So how does it work? Imagine you have a faulty amplifier in a complex orchestra.
Okay,
It's blasting out one note way too loud, and it's drowning everything else out.
right.
RNA is like being able to turn down the volume on that specific amplifier.
Mm.
So in this case, the amplifier is a gene, and the loud note is a disease-causing protein.
So you're basically gaining control over the body's protein production in a very targeted way.
Yeah, exactly.
What I find really interesting is this isn't some artificial thing.
Right.
You know, the article mentions that RNA is really harnessing something that's already happening in our cells.
Absolutely. It's utilizing a natural process to fight disease.
Oh.
It's not about altering our DNA like some other genetic medicines might do.
Hmm.
RNA targets the messenger RNA,
Okay.
which carries instructions from our genes to the protein-making machinery.
So instead of like rewriting the entire musical score, you're just tweaking the conductor's notes a little bit.
That's a great analogy.
And that's a big part of what makes this different from something like CRISPR, right?
Exactly.
CRISPR's going in and actually editing the DNA itself.
Permanent changes.
Yeah.
Whereas RNA is more like a temporary intervention.
Right.
It silences the gene for as long as the treatment is active.
So this temporary aspect seems to be key to some of the advantages of RNA.
It is.
The article highlights the long-lasting effects of some of these treatments.
Right. So instead of taking daily pills, patients might only need a few injections a year.
Wow.
Think about the implications for chronic conditions.
Yeah.
It could radically reduce the burden of medication management, potentially lead to better adherence to treatment plans.
That's huge. And, you know, there's even a quote from Kausic Ray,
Oh, yeah?
who's a cardiologist. And he says, instead of relying on the patient to take over 300 pills a year, you can give a couple of injections. It almost sounds too good to be true.
It does sound amazing.
Are there downsides to this approach?
Well, there are always challenges with any new technology, right?
Sure.
One of the key things to consider is delivery.
Okay.
How do you get these RNA molecules to the right cells in the body?
That makes sense.
It's not always straightforward.
Yeah, our bodies are good at protecting us.
They are.
And I imagine getting something to a specific target, especially, you know, if it's deep within an organ or something.
Exactly.
That's got to be tricky.
It can be.
Yeah.
And then there's the question specificity.
Okay.
We want to make sure that the RNA is only silencing the intended gene
Uh-huh.
and not affecting other processes.
So it's kind of like making sure that your conductor's only adjusting the volume on that one specific instrument
Right.
and not accidentally, like, muting the entire string section or something.
That's a perfect analogy.
Okay, good.
Yeah, so that's why scientists are constantly working to refine the design of these RNA molecules, making them more targeted, more efficient.
So early on, a lot of the RNA research focused heavily on rare genetic diseases.
Yeah, that's right.
The article mentions a condition called HAT amyloidosis.
Heteroamyloidosis, yep.
But it seems like the field is kind of shifting towards more common conditions, like high cholesterol. Is that right?
You're absolutely right, and that's one of the most exciting aspects of this field. As the technology matures and we gain more confidence in its safety and efficacy,
Uh-huh.
we're starting to see applications for diseases that affect millions of people.
This shift from rare to common diseases seems like it could be a real turning point in healthcare.
It could be a game changer.
Yeah, it's not just about treating the sick, it's potentially changing how we even think about preventing disease in the first place.
That's a key insight.
Yeah.
We could be moving toward a future where we use RNA to proactively target risk factors before they even develop into full-blown diseases.
That raises a lot of interesting questions
It does.
about how this is going to impact, you know, the healthcare landscape in the years to come.
Absolutely, and it's a topic we'll definitely be exploring further in the next part of our deep dive.
Okay, great.
But before we get there, I want to turn the focus back to you.
Okay.
What's standing out to you so far about the potential of RNA?
I think what's really hitting me is this idea of precision.
Yeah,
You know, we've been talking about this analogy of a conductor fine-tuning an orchestra.
right.
And it just seems like RNA offers this incredible level of control
It does.
over these really complex biological processes.
Absolutely. It's about targeting the root cause of the problem.
Yeah, and not just masking the symptoms.
Exactly.
And that's something that I think has the potential to really revolutionize how we approach treating and maybe even preventing a whole range of diseases.
I agree.
It's pretty mind-blowing when you think about it.
It is, and we're just scratching the surface of what's possible.
Well, on that note, we're going to take a quick break, and when we come back, we'll delve into some specific examples of how RNA is being used to target different diseases.
Sounds good.
We're back and ready to dig deeper into these RNA therapeutics.
Yeah, let's get specific.
Yeah, in the first part, we were talking about the kind of general idea of how RNA works.
The mechanisms.
Yeah, but I'm curious,
Yeah.
what does this actually look like in practice?
Okay.
What are some of the diseases
Sure.
that researchers are actually targeting with this?
Well, as we mentioned earlier,
Uh-huh.
there's been a lot of success with rare genetic diseases.
Okay.
One striking example is a condition called Hatchar amyloidosis.
Hatchar amyloidosis.
Yeah, it's a mouthful.
Okay, so break that down for me.
It's caused by the buildup of a misfolded protein, and it can affect various organs, leading to heart problems, nerve damage,
Wow, so one
all sorts of serious issues.
malfunctioning protein can just throw a wrench in the whole system.
It can. It's incredibly debilitating.
Sounds like it.
And for a long time, there were very limited treatment options, but now
Okay.
there's an RNA therapy that specifically targets the gene responsible for producing that faulty protein.
So you're essentially stopping the problem at its source,
Yeah.
instead of just trying to manage the symptoms after they occur.
Right. You're preventing those misfolded proteins from being produced in the first place.
Okay.
Exactly.
And what are the results like?
The results have been really impressive.
Oh, wow.
Clinical trials have shown that this RNA therapy can slow the progression of the disease,
Uh-huh.
improve quality of life, and even extend survival for patients.
That's huge. I mean, not just for the patients themselves,
Of course.
but for their families as well.
Absolutely. It's a huge relief for everyone involved.
I bet it is.
It's incredible to see those kinds of results after years of struggling with a seemingly untreatable condition.
So it sounds like RNA is offering hope where there really wasn't much before.
It is, and this is just one example.
Okay.
There are other rare genetic diseases
Uh-huh.
like acute hepatic porphyria where RNA therapies are showing real promise,
Okay.
but the focus isn't just on these rare conditions anymore.
Right, and that's kind of what we were hinting at before
Yeah.
with this shift towards more common diseases.
Yeah.
Like the article specifically mentioned high cholesterol.
High cholesterol, yep.
I mean, that
A
affects,
huge portion of the population.
yeah, pretty much everyone knows somebody
Right.
who's dealing with that.
And traditional treatments like statin,
Uh-huh.
while they're effective for a lot of people,
Yeah.
they don't work for everyone.
Okay.
And they often require daily doses.
Yeah.
Which can be a hassle.
I can imagine.
Right. And even if you're good about taking your medication,
Sure.
there can be side effects.
Right, so how does RNA fit into this whole picture?
Well, scientists have discovered that a gene called PCSK9
PCSK9.
plays a big role in cholesterol regulation.
Okay.
Basically, the protein produced by this gene interferes with the liver's ability to remove LDL cholesterol.
LDL, that's the bad cholesterol, right?
That's the one, yeah.
Okay.
From the bloodstream.
So it's kind of a kink of the hose that's supposed to be cleaning things up?
Exactly.
Okay.
And with RNA, we can target that PCSK9 gene, silence it,
Uh-huh.
and essentially smooth out the hose, allowing the liver to do its job more effectively.
So then you wouldn't need those daily doses of medication.
You got it.
Wow.
We're talking about a few injections per year, potentially. But then clinical trials have shown that this can significantly lower LDL cholesterol levels, even in people who don't respond well to statins.
That's amazing. It opens up a whole new avenue for preventing heart disease,
It does.
which is, a leading cause of death.
a major problem.
Yeah, worldwide.
Absolutely.
So we've talked about rare diseases,
Right.
high cholesterol.
Mm-hmm.
What other areas are researchers looking at with RNA?
One area that's generating a lot of excitement,
Okay.
although it's still early stage,
Okay.
is the application of RNA to neurodegenerative diseases
Okay.
like Alzheimer's and Parkinson's.
Those are,
Big ones.
yeah, diseases that hit close to home for a lot of people.
They do, unfortunately.
I know I've had family members who have been affected by Alzheimer's.
Yeah.
And it's just heartbreaking to see the toll it takes.
It is, and right now there are very limited treatment options
Yeah.
that can truly slow down or reverse the progression of these diseases.
So where does RNA come in?
Well, in Alzheimer's, for instance,
Okay.
there is a buildup of a protein called amyloid beta, which forms plaques in the brain.
Okay.
And researchers believe that targeting the gene responsible for producing amyloid beta could potentially reduce plaque formation and slow the disease's progression.
So it's similar
Kind of a similar approach.
to what we were talking about with the Hatchar amyloidosis.
Exactly.
Stopping the production of that problematic protein.
At the source.
Yeah, but I imagine the brain presents some unique challenges, right?
Absolutely.
I mean, it's such a complex organ,
It is.
and it's so delicate.
One of the biggest hurdles is delivery.
Okay.
The brain is protected by a barrier that's very selective about what it lets in.
Yeah, it needs those safeguards.
It does. It makes it difficult to get RNA therapies to where they need to be.
That makes sense.
But scientists are working on innovative ways to overcome that barrier,
Okay.
using things like nanoparticles or modified viruses to deliver the RNA therapies directly to the brain cells.
It sounds like there are still a lot of challenges to overcome,
There are.
but the potential benefits here are just huge.
Huge.
If we can find effective ways to treat these neurodegenerative diseases,
Absolutely.
it would be transformative.
Transformative, yeah.
And honestly, it's pretty amazing to think that we're even talking about the possibility
Right.
of using RNA to target something as complex as Alzheimer's.
It is. It speaks to the incredible power of this technology
Yeah.
and the ingenuity of the researchers who are pushing the boundaries of what's possible.
Pushing those boundaries.
But as with any powerful technology, it's important to consider the potential risks and ethical implications as well.
That's a great point. And it actually leads us nicely into the final part
Okay.
of our deep dive today. Okay, so we're wrapping up our deep dive into RNA therapeutics.
RNAi.
And we've covered a lot of really fascinating ground.
It's a big topic.
Yeah.
Yeah.
From, how it actually works at a basic level.
Right.
To the potential for treating, all these different diseases.
Yeah,
It really does seem like a game changer.
I think so.
But, as with anything, there are two sides to every coin, right?
Absolutely.
So what are some of the risks that we need to think about with RNA?
Well, one of the primary concerns is something called off-target effects.
Off-target effects, okay.
So basically this means that the RNA molecules could unintentionally silence genes other than the intended target.
So not just that one bad gene that you're trying to turn down.
Right, exactly.
Okay.
It's like hitting the wrong note on a piano. It throws off the whole melody.
You're messing up the whole orchestra at that point.
Yeah, potentially.
So what you're saying is there's a chance that RNA could interfere with, other processes that are actually important for the body.
That's the risk, and it's something researchers are very aware of.
Okay.
They're constantly working to refine the design of RNA molecules, making them more precise and targeted to minimize the chances of those off-target effects.
So it's all about increasing the accuracy, like really honing in on that one specific gene.
Exactly, like a laser beam.
Okay.
And then there's also the potential for immune reactions.
That makes sense. Our bodies are good at recognizing.
Foreign invaders?
Yeah, when something doesn't belong,
Right.
they're ready to fight it off.
And sometimes they might see those RNA molecules as a threat
Okay.
and mount an immune response.
So what happens then? What does that look like when the body reacts to the treatment?
Usually these immune reactions are mild,
Okay.
maybe some temporary inflammation or flu-like symptoms. But in some cases, they can be more severe.
Okay.
That's why researchers are exploring ways to modify the RNA molecules to make them less likely to trigger the immune system.
So it's like a balancing act.
It is a balancing act.
You want it to be effective, but you also want it to be safe for the patient.
Absolutely. Safety is paramount
Long term.
when you're talking about any new medical technology.
Yeah, this is all pretty new.
Yeah, and because RNA is relatively new,
Uh-huh.
we're still learning about those long-term effects.
Okay.
Ongoing monitoring and clinical trials are essential
To make sure it's doing what it's supposed to be doing.
to ensure that these therapies are both effective and safe for patients.
It's a good reminder that progress in science takes time.
It does. It's a marathon, not a sprint.
There's always more to learn.
Always.
More to refine.
Absolutely.
But it's so exciting to think about all the possibilities
It is exciting.
that RNA holds for the future.
It has the potential to be truly revolutionary.
I mean, we've seen some breakthroughs already.
We have.
And as the technology gets better,
Yeah,
I think we could expect to see even more, innovative applications.
for sure. And we'll be here to cover them.
Exactly. So stay tuned for those.
Yeah.
Thinking about this whole deep dive,
Yeah.
it really does feel like we're entering this new era in medicine.
I think so too.
This ability to target diseases at their root, at the genetic level.
At the source.
Yeah, it opens up so many doors.
It's incredible.
But as we step through those doors, we got to be careful,
We do.
right? We have to think about the safety,
Right.
the ethics, all the long-term implications of this really powerful technology.
Absolutely. It's not just about the science. It's about using that science responsibly.
Yeah, for the benefit of everybody.
For the benefit of all humankind.
Well, I think this has been a really fascinating exploration of a truly revolutionary field.
I agree.
And for anyone listening, I hope this has sparked your curiosity about the future of medicine and the incredible potential of RNA therapeutics.
Me too. It's an exciting time to be following this field.
It is. Thanks for joining us.